The terms overlap disease and undifferentiated connective tissue diseases aren't always clearly defined by rheumatologists. The term overlap disease is usually used when there's presence of two different disease processes in one patient. For example, presence of lupus-like features and rheumatoid arthritis, termed Rhupus, or the presence of muscle inflammation, polymyositis, and scleroderma features. Typically, we see this in patients who have an antibody called PmScl. By contrast, undifferentiated connective tissue disease is where someone has some features of a connective tissue disease and maybe some antibodies, but it's not sufficient to make that diagnosis formally. This could be someone with a bit of dry eyes, dry mouth, perhaps a rash and some joint pains, and they might have an antibody like an anti-nuclear antibody, but there's insufficient detail there to diagnose lupus. Depending on the extent of organ involvement, this might require treatment, but in some cases of undifferentiated connective tissue disease, monitoring is all that's required early on to see if this develops into something that does require medication.